from workers from different institutions on the different issues, things that we've gone through. We are outraged over our governor and the secretary giving these exuberant raises to the staff members, cabinet members, when state workers have not had a raise, a decent raise since 2008. You take a 1.2% and they go up on insurance, that's nothing. We don't feel that you should give $82,000 raise to 2 interns, no service to the system, just because they donated to your campaign, the governor's campaign. That's not
right.
fair. You got 10-year state workers. I'm a 21-year, 6-month employee of the state of North Carolina. You know, you're going to bring in somebody with 2 years, no experience, and get them up to $82,000? That's BS. It's not fair to the working people. Right. Then you're going to remodel the mansion, the bathrooms in the mansion. That's money that we as state workers can have. It's ridiculous that you're going to do this kind of thing and deny us these basic rights. So as I say, we have legislators, we have community support that's going to speak on the issues. We also have Senator Representative Insco. We have Vicki Smith from Disability Rights. We're supposed to have John Davis and Reverend Gatewood from the Forward Together movement. I also want to say that our union has been pushing disability rights for a long time. And Representative Larry Bell has introduced a bill, House Bill 130, Mental Health Worker Bill of Rights. We got to continue to push. Like I said, we're not asking for exuberant things. We're asking for basic human rights to be able to do the job that we were hired to do. And it's going to take continued pressure on this government, on our legislators, to get this job done. I like to personally thank all my co-workers from the different institutions that come out to testify on our behalf, because all of us together, that's the only way we're going to make a difference. And until they give us a seat at the table, we're going to keep dealing with the same stuff over and over again.
That's
As
right.
I said, in 2001, when we had, what was the name?
Hooker
Odom. When they first introduced the state reform plan, the idea was to reduce the number of beds in the psych hospitals and put them into the communities. We tried to tell them in 2001, it's possible, but there has to be a way that you do that. But they would not give us a seat at the table. They went and did what they wanted to do. They reduced the amount of workers that you had. They sent the people out into the communities. And in a matter of a little while, what would happen? Back to the hospitals. But when they come back to the hospitals, the staff wasn't there to take care of them. The nursing homes that they put them in, they weren't qualified. They weren't ready for that. There should have been a period of adjustment to train people out. They didn't do that. They still move forward. We fought with them about closing dicks. Same thing. Okay, they built since original. Again, no frontline input. When they get ready to go in there, what they got to do? They got to redo a whole lot of stuff, a whole lot of money. Money that workers could have had for a raise that we didn't get. Now what they do? They build a new facility in Cherry, in Goldsboro. No input. It's going to be the same mess. Wasting taxpayers' money, wasting state money, when we could have a raise, do the job that we were hired to do. That's enough for me. I'm going to let somebody else talk. I think first, Representative Insco.
Steve,
good morning, and thanks to everybody for coming out today. I want to speak first of all on behalf of the mental health workers who are here with us today. I'm really pleased to see this group out. There's nothing like advocacy and for the workers to get out and demonstrate and do their own advocacy. Secretary Vosh is adding a lot of people to her PR staff, and this is the PR staff for the workers, and I'm proud to stand with them today.
That's right.
These are the people who do the work with the patients. We do not pay them a living wage. We do not provide the training that they need in order to handle very difficult situations, and we have a zero-based policy. No problems, or it's the worker's fault, and often these situations are very dangerous. And so I speak not only on behalf of the workers, but on behalf of the patients that they take care of. The workers need adequate training. They need enough staff there that they're not put into dangerous situations, and they need a living wage. I also want to talk about a little bit about Medicaid expansion. One of the I think one of the most egregious decisions that we made last year was not to expand Medicaid.
Yes.
The state is, not only are we not providing health services for more than 300,000 people who would be newly covered, very sick people, but we gave up $16 billion over a period of 5 years and gave up 2,200 jobs. We need jobs in North Carolina. We need to be using the tax dollars that are going to the federal government from North Carolina need to be coming back into the state to provide services here and to help stimulate our economy. So I hope we can keep these messages going throughout, and so that these issues can be a part of the campaign next year. And I really thank the organization for having this press conference and for doing this advocacy. Thank you very much.
Thank you.
All right.
That's the kind of legislation that we need. A working class one. That's what we need. Okay. Next, I'm going to ask. Let's go from the legislation to one of the workers. Want to speak? I'm going to ask our brother Kevin Yancey, who's our state chief steward for the union.
Yeah, she is.
He's going to speak to you for a minute.
Oh, okay. Can you hold this?
Good morning, everybody. It's a beautiful time to be out. I'm going to be before you just for a brief moment. I want to speak on the point of our grievance procedures that we have here in the state of North Carolina. It was already a few years ago. Our grievance procedures have been known as some of the strictest in the state of North Carolina when it comes to the staff filing grievances, and they had so many hurdles to jump over. In the U.S. justice system, you're considered innocent until proven guilty, but in the DHHS system, it's just the other way around. You're guilty until proven innocent. And oftentimes, when we are experiencing things like false allegations and all kinds of other things, which is a natural part of our job, we have to go through the grievance procedure before we can even find any sense of justice. Well, we found out that this was a grievance procedure that was stacked up against us. Now we're finding, thanks to Governor McCrory, that he's made it even tougher for us to handle those grievance procedures. Now what he has is that he started a new committee and new grievance procedures that he's already passed that's going to make it virtually impossible for you to find justice outside of a courtroom. What he also did is he extended it even further. Did you know that the new employees now have to be on a 24-month, what is it? 2 years before they become full-time employees. And they are at will, virtually at will employees. What does that mean? You can be fired at the will of the supervisors, at the will of the managers and directors who seem to have a chip on their shoulder when you're dealing with them. For those who work in the system, you know what I'm talking about. Well, what we want to do is we want to do just the opposite. We want to push back against these policies and these procedures that make it impossible for us to do our job. Because our number one concern when we get there is our individuals, our clients that we serve. And a lot of times people just overlook the fact that we are like family to a lot of them. I know we do a therapeutic job, but we're like family to a lot of these clients that we serve. And they have their problems and their issues, and that's what we're trained to do. But we have a loving thing that we do with them. So what makes it even harder is these grievance procedures. And what we want to do is we want to do something different. You know, we want to do just like the teachers are doing. You know what the teachers are going through. The teachers, they're losing tenure, and their salaries are cut. They have issues with they don't even have assistants like they used to have teachers' assistants. And you remember how you used to have the nursing aide. Everybody who's been in school knows there's a nurse's aide that you go to when you get sick. Well, they've even Governor McCrory has even cut that. Now when my grandson gets sick in school, his teacher has to step in and be the nursing assistant or call someone who has to call the nursing assistant who may be in one of the other schools because they have cut so many that there's not enough to go around. I think we need to say no to all these policies, no to their way of looking at things. It's just egregious. It's just way beyond what it should be. It's inhumane. That's what it is. And when these grievance policies and procedures and things strike at the heart of our workers and our teachers, it hurts the people we really care for, our clients and our students. Thank you.
Right on, right on.
Thank you, Brother Kevin. I want to add to that when we talk about grievances and the state personnel. He tried to take it out of the office of hearing officer. We fought hard to keep that. And we fought because in the past, we've burnt the state when it comes to handling some grievances. They spend a lot of money because they've had to reinstate workers. They had to give them back pay, you know. And they're going to learn when you're dealing with UE. When we come to you with a grievance, we're not jiving. We got our facts. We got our ducks in a row. We know what we're talking about, you know. So when you learn that when we come to you, we're not playing. Go on and give it up because we come to you correct. So it's costing a lot of money to reinstate these workers, you know. We're going to continue to fight. Like I said, he was trying to take it out of the judge's hand. But we fought against that and said, no. We still need to be able to file our grievances, and then the Office of Occupation hears our grievances. Okay, now we're going to listen to Ms. Vicki Smith, another ally of UE150. She served on several forums that we've had in the past, talking about workers' rights and stuff. Thank you, Vicki.
Good morning. My name is Vicki Smith, and I work with Disability Rights North Carolina. And our responsibility or charge is to ensure that people with disabilities are safe and receive humane treatment and get the treatment they need. Where our concerns intersect with the workers' rights is that underpaid, overworked, exhausted, and poorly trained employees of facilities, that impacts direct patient care. And so when you have workers in a facility who are working extended hours, worried about their life in terms of not receiving a living wage, that's going to impact the quality of care that people get.
That's right.
And so we support highly trained, qualified, and fairly paid workers treating people with disabilities. Thank you.
Thank you.
Thank you, Vicki. Next, we're going to call Benita Johnson. She works at Murdoch Center. She's going to be speaking about wages.
Good morning. Good morning. I am here to talk about the state employees' wages. Most of the state workers are living in below poverty levels and are forced to work second jobs to provide enough income and support for their families to keep up with the ever-rising living costs. No matter how much seniority, after working on their jobs 5 to 10 years, 82% of our healthcare workers and technicians are stuck at the bottom of their salary grade, which is only about $25,000, and have not had a raise since 2008. The food and nutrition workers are paid even less and are required to wear hairnets, uniforms, and special shoes, which of course are non-open-toed shoes, and are expected to buy these required items out of their pay, which should be used to support their families. That's right. Yes. Right. You have to excuse me. I tried to write this thing out.
You good?
We, as and I'm not going to read this. We as state employee workers work very hard at what we do to not be considered for raises, whereas our governor feels that his workers, or who his campaign workers, who, like she says, done nothing, are getting paid at almost $2 million. Money that could have gone for our families. Money that could have gone for the short-handedness that we have on our jobs, to supply us with the things that we need to get our jobs done safely, and the employees that need to be there in order for us to do this. Our state decides that we need CS time or bonus leave time
Benita.
in place of money. We no longer want the CS time. Thank you. The CS time or the bonus leave time. We need money. Okay, sorry about that.
You're good.
Okay, these monies will take place, will, help us with the hardships that we have, the stresses that we go through on a day-to-day basis, trying to do what we do. The CS time and the BL time leads us to feel that we are just being BS'd. Thank you.
All right.
Thanks, Benita. Okay, next we're going to hear from a good friend of mine. We've been in this fight a long time. Sister Beverly, I tell you. Call her one of Anita. She's there on the spot. She's going to talk about the RNs, what we call the Hawk Plan. This is something that Secretary Woos come up with, supposed to save the state money. But anyway, Beverly can give you the 411 on that one.
Who's Beverly?
Beverly
Moriarty.
Beverly L. Moriarty.
No. Who?
Hi. Yes, I've been a nurse for over 50 years, and I have been in the mental health system for 30 years. I have worked for the state of North Carolina for 20. It brings tears to my eyes to feel that I'm still here fighting this fight. But I will tell you that over the last 20 years, there's been a steady erosion of the salaries, our job safety, job security, our benefits, and the satisfaction in our jobs. 20 years ago, you didn't have to pay somebody $312,000 to try and recruit people to the state to try and get loyalty and longevity, because people were loyal. They came in, this was a generational thing. People came in with their parents, their children, and their children's children stayed to work in the state. Although our salaries may not have been totally commensurate with the public sector or the private sector, we had benefits that made us feel that we had job security and we were devoted to our jobs. It was like working in a family. It was a joy to go to work. We fought for this hospital and we fought for mental health because people were a family. Today, that has long been gone. And as I said, you didn't have to pay somebody $312,000 to come in and try and get recruitment. Today, as I walk through the hospital, I see people coming up to me and saying, I can't wait to get out. I'm going to take early retirement. I'm going to leave. These are the RNs. 46% of some of our RNs in the since 2012 have been saying they want to leave the hospital, and they have left the hospital. One of the reasons is that, as I said, we've had an erosion of our benefits. Salaries. I've worked for 20 years in this hospital, and we've had raises 3 times. One of those raises was a paltry 1.2%. Hardly cost of living raises. So people who are leaving this state after 20, 30 years of loyalty and longevity are being paid less than people who are now going to possibly be recruited to come into the hospital. That's a shame and a disgrace that people, having shown the loyalty that they're now trying to pay someone $312,000 to get, are leaving the state without having any improvements in their salaries. Nurses at one point did get a 10% raise because they were so short of nurses, but our lowest paid people are technicians who could not do our job. I would not be a good RN if I did not have the loyalty and the experience of the people who work with me, who do their job and work directly with the patients, who have been sitting here languishing on not getting any pay raises. And I've been fighting for that for 20 years. It's a disgrace that we are at this point in our situation. Benefits have been eroded. At one point you could retire after 20 years. It is now, I think, 25 to 30 years before you can get a retirement. You used to be able to have, you were on probation for 9 months. Certainly after 9 months you know whether you've got a good worker here. Now it has been extended to 2 years. You used to be able to have longevity pay for those people who worked in undesirable shifts, like the second and the third shifts. They are no longer getting any longevity pay. There used to be let me forget some of the things, but yeah, but so many of our benefits have been eroded away. But people were working here even with poor salaries because there was loyalty and there was a commitment to the job that they were doing. One of the other factors that I think people need to look at is that we had a hospital that was centralized, where the population of people were, where our patients were coming from, where our staff worked, and where the families worked. They have now decided to put our hospital in the middle of nowhere so that people now, added to the lack of having any increases in their salaries, are paying an additional $200 to $300 a month to pay for transportation to get to these jobs. Take away from that is also the fact that they are now working not an 8-hour shift, but a 10-hour shift because they have to travel another 2 hours to get to that. That is if you're fortunate enough to be able to work and live on an 8-hour-a-day shift. Most people are working 16 hours a day. That's 18 hours a day. No time to be with your families, no time to be sleeping, and of course this erodes away the safety on the job and the care that you can give to your patients. This is a disgrace that we are now asking someone to come in and try and develop loyalty when for years there was nothing but loyalty to be a state worker. So I am sad to say that I am at a point that 20 years after our fight has begun, that we're still in the fight and the situation has eroded to this point.
All right. Thanks, Bev.
Thank you, Sister Bev. At this point, we're going to hear from Senator Don Davis, who has joined us.
All right.
Well, good morning.
Good morning.
My name is Don Davis, North Carolina Senate District 5, and I'm proud to represent many state